So, hello students, how are you? The revision is going on. Let us discuss some PYQs of anatomy, image based questions. Okay, IBQs, image based questions. Let us discuss important things, understand, answer, be interactive. So, I'm Dr. Pradeep Pawar, Professor of Anatomy at PW Med Ed. So, we at PW Med Ed are constantly striving for the well-being of yours students. Okay, so I hope this lecture will be useful for you. All the MCQs, all the image-based questions will revise. Chalo, let us start now. Starting with the first MCQ, students. Have a look at this. Look at this MCQ. The structure marked E in the image given below gives rise to which of the following structures? So what do you think is this, students? This is a section taken from the abdominal cavity, an embryonic. So that's the stomach. Have a look at this. This is the stomach. And you know, students, this is the stomach, right? And the stomach is connected to the anterior abdominal wall by ventral mesogastrium, correct? So this is the anterior abdominal wall. So the stomach is connected to the anterior abdominal wall by what is A? That's the ventral mesogastrium. And what is B going to be? B, that's the dorsal mesogastrium. The stomach is connected to the anterior abdominal wall by the ventral mesogastrium, to the posterior abdominal wall by the dorsal mesogastrium. Correct? Now, what develops in the ventral mesogastrium? Let us understand this, students, so it will be clear to you. So, if that's the stomach here, this is the dorsal mesogastrium, this is the posterior abdominal wall, that's the ventral mesogastrium, that's the anterior abdominal wall. Now, what develops in the ventral mesogastrium? Any guesses what develops in the ventral mesogastrium? Is the liver. The liver grows in the ventral mesogastrium. And the moment the liver grows in the ventral mesogastrium, it is going to divide this ventral mesogastrium into two parts, right? From the anterior abdominal wall to the liver, what do you call this as? This is what we call as the falciform ligament. From the anterior abdominal wall to the liver, this is what we call as falciform ligament. And from the liver to the stomach, this is what we call as the lesser omentum. Lesser omentum. Perfect. So from the anterior abdominal wall to the liver, this becomes a falciform ligament, and from the liver to the stomach, this becomes a lesser omentum. So what grows in the dorsal mesogastrium? What is that which grows in the dorsal mesogastrium? Any guesses? The spleen, right? The spleen develops in the dorsal mesogastrium. Let me use this color. So the spleen develops in the dorsal mesogastrium, and the moment the spleen develops in the dorsal mesogastrium, it divides the dorsal mesogastrium into two parts. Can anyone tell me what are these two parts? From the stomach to the spleen, what do you call this as? The gastrosplenic ligament. And from the spleen to the kidney, behind is the retroperitoneal organ, that's a kidney. So what is this known as? Lenorenal ligament. So from the stomach to the spleen, that's a gastrosplenic ligament, and from the spleen to the kidney, that becomes a lienorenal ligament. So these are the derivatives of the dorsal and the ventral mesogastrium. Perfect there. Are you able to follow this? So let us come back to this. Okay, let us come back to the slide. So the structure marked E in the image below gives rise to which of the following structure? What do you think is the answer? Yes, that's the falciform. Yes. Answer is going to be the falciform ligament. Here, the gastrosplenic ligament, the lienorenal ligament, and the gastrophrenic ligament, all this are derived from the dorsal mesogastrium. So what are the derivatives of ventral mesogastrium? Number 1, falciform ligament. Number 2 is the lesser omentum. Number 3 is the superior and inferior layers of coronary ligament. Number 4 is the right and the left triangular ligament. The liver develops in the ventral mesogastrium. So all the ligaments of liver are derived from the ventral mesogastrium. What are the derivatives of dorsal mesogastrium? Number 1, the gastrosplenic ligament. the lieno-renal ligament, the greater-omentum, and the gastrophrenic ligament, the gastrophrenic. Perfect. Here with all of you? Yes. Let us proceed to the next MCQ. I hope students you're understanding this. If there's anything which is not clear, let me know. Identify the cartilage given below. Yes, any guesses? So what are the three types of cartilage? Histologically, how do you identify cartilage? There are three cartilages. One is a hyaline cartilage, the second one is a yellow elastic, and the third one is a white fibro. Hyaline, yellow elastic, and white fibro cartilage. Now what do you have in the cartilage? You've got chondrocytes, right? Chondrocytes. And there's a ground substance, matrix. So the cells are known as chondrocyte, and the surrounding structure is known as the matrix. Now, if the matrix contains, any guesses? If the matrix is amorphous, it's a ground glass appearance. So what is that cartilage? That's a hyaline cartilage. The hyaline cartilage will have chondrocytes. It will have perichondrium. Number one is the perichondrium. Number two are the chondrocytes are present in groups. Look, they're present in groups like this, a group of 2, 3. What do you call this group as? Cell nest. So what are the characteristics of hyaline cartilage? The perichondrium is present. Okay, I'll just write in short. Perichondrium is present. Chondrocytes are found in group. What is that group known as? The cell nest. Chondrocytes are found in group. The groups are known as cell nest. And the matrix is glass-like appearance. Matrix is glass-like appearance. Perfect. So this is about the hyaline cartilage. Where do you get this hyaline cartilage, students? Hyaline cartilage is found in the trachea, the thyroid cartilage, the cricoid cartilage. These are all examples of hyaline cartilage. This is extremely important. This all is asked in the MCQs. Now, coming to the elastic cartilage. In elastic cartilage, other than the chondrocytes, what are we going to get? We are going to get yellow elastic fibers. So we are going to get elastic fibers in the matrix, and the chondrocytes are largest in size. Chondrocytes are largest in size in elastic cartilage, right? Perichondrium is present. So number one, perichondrium present, chondrocytes are large in size, and elastic fibers are present. Examples of elastic cartilage is pinna, epiglottis. Epiglottis is an example of elastic cartilage. Yeah. Now coming to the third type of cartilage. The third type of cartilage is white fibro cartilage. So now, in addition to the chondrocytes, what do we get in the white fibro cartilage, students? We get collagen fibers. Plenty of collagen fibers. Can you have a look at this? These are plenty of collagen fibers, and because of this plenty of collagen fibers, the chondrocytes become small in size. Very small chondrocytes. So perichondrium is absent in white fibro cartilage. Chondrocytes are small in size, and you get collagen fibers in bundles of collagen fibers. So this is white fibro cartilage. Example is articular disc, menisci, intervertebral disc. Just remember the characteristic of this cartilage. Remember the examples of this cartilage. Perfect. Students, clear? So how do you differentiate? Hyaline cartilage, perichondrium is present, chondrocytes are found in groups, that's cell nest, and the matrix is amorphous, ground-like appearance. Example is thyroid cartilage, cricoid cartilage, the trachea. Right, coming to the elastic cartilage, we get elastic fibers in the matrix, perichondrium is present, chondrocytes are large in size. Example is epiglottis and the pinna. Coming to the white fibro cartilage, perichondrium is absent, chondrocytes are small in size, and plenty of collagen fiber. Example is intervertebral disc, articular disc, menisci. Perfect, students. Are you able to follow this? This is extremely important. We are discussing all very important image-based question. Clear? Come on, let us go to the next MCQ. So the answer here is white fibro. This is a white fibro cartilage. Going to the next slide. Have a look at this. Come on, students. Can you identify this? A patient presented with a squint in the right eye, as shown below. Identify the nerve lesion in this case. Yes, students. Be interactive. Come on, if you can answer this. Now, if you see this eye, look at this eye. Where is the where is the eyeball going towards the medial side? The eyeball is being pulled towards the medial side. That means which muscle is paralyzed? Chalo bachcho, answer this. Eyeball is pulled towards the medial side. That means medial rectus is powerful. That means which muscle is paralyzed? Can anyone tell me this? Which muscle is paralyzed? The lateral rectus. Very good. Yes, that lateral rectus is paralyzed. Because the lateral rectus is paralyzed, who becomes powerful? The medial rectus. The medial rectus pulls the eyeball medially. Ab kya hoga? What will the person get? A medial squint. Medial squint. So this is a right medial squint. Right medial squint. Paralysis of which muscle? Paralysis of lateral rectus. Are you able to follow, bachcho? Lateral rectus is going to pull the eyeball laterally. So lateral rectus paralyzed ho gaya. The medial rectus becomes powerful, pulls the eyeball medially. That's a medial squint. So who's going to supply the lateral rectus? Yes, answer this. The lateral rectus, you remember this mnemonic? LR6SO4. So the lateral rectus is supplied by 6th nerve. That's the abducens. And the superior oblique is supplied by trochlear. Trochlear nerve. So which muscle is paralyzed? The lateral rectus muscle is paralyzed, and this lateral rectus is supplied by which nerve? The answer is abducens nerve. Abducens. So the answer for this MCQ is going to be abducens nerve. Hey, hello students, come on, be interactive, answer, come on, come on, come on. The more you interact, the more easy it is going to be for me to teach, for you to understand. Okay, perfect. Clear? The concept is clear? So all the extraocular muscles are supplied by which nerve? Now we have got a medial rectus, lateral rectus, superior rectus, inferior rectus, 4 rectus, 2 obliques, the superior oblique, inferior oblique. So all the extraocular muscles are supplied by which nerve? Oculomotor nerve, except the lateral rectus, which is supplied by 6th nerve, abducens, and the superior oblique is supplied by 4th nerve, that's the trochlear nerve. Perfect. Very good, very nice, very good. Chalo, good, good. So the answer here is abducens nerve. Let us go to the next MCQ. Come on. Come on, come on, come on, bachcho. Can you answer this? The type of joint at the marked site, at the site marked by the arrow. Chalo, can you answer this? So you can see this is a vertebrae here and this is a rib here. So bachcho, what vertebrae is this? What is this vertebrae? This is a thoracic vertebrae. Clear? We are seeing a rib, no bachcho? We are seeing a rib. So this vertebrae is going to be a thoracic vertebrae. And this thoracic vertebrae has got a facet on the body. Ek chota sa na facet is here on the body where the head of the rib is going to articulate. The head of the rib fits into the body of the thoracic vertebrae. And what is this? This process, transverse process. The transverse process also has got a facet here. What fits into this facet is the tubercle of the rib, the tubercle. So the tubercle of the rib fits into the transverse process. The head of the rib fits into the body of the thoracic vertebrae. Clear, students? So how many ribs, how many joints is a rib going to form? How many joints is a rib going to form? Number 1, any guesses? Chalo bolo. 1 is the costovertebral joint. Costovertebral joint. What is costovertebral joint? The head of the rib articulates with the body of the vertebrae. The next joint is the costotransverse joint. The tubercle of the rib articulates with the transverse process of the vertebrae. And both these joints, the third joint, the rib would go in front. Anyone can guess and tell me the rib would go in front. And what is the rib articulating with? Not the sternum. No. It doesn't articulate with the sternum. No, what you said is wrong. It doesn't articulate with the sternum. It articulates with the costal cartilage. And this is the costal cartilage. So a rib is going to articulate with the costal cartilage, which then articulates with the sternum. Right? So what is this third joint? Can anyone tell me what is this third joint? This joint is known as the costochondral joint. Costochondral joint. So the shaft of the rib articulates with the costal cartilage. This joint is known as the costochondral joint. So costovertebral joint, costotransverse joint, and the costochondral joint, all these joints are said to be what? Synovial joints. All these joints are synovial joints. Okay, and there are movements which takes place at this joint, right? So one is this movement. What is this movement? The pump handle movement. The second one is this movement. What is this? The bucket handle movement. So bucket handle movement changes which diameter of the thorax? The transverse diameter. The pump handle movement is going to change which diameter? The anteroposterior diameter of the thorax. Are you able to follow the students? So rib shows three joints. One is costovertebral, second is the costotransverse, and the third one is the costochondral joint. And all these joints are synovial joints. Perfect. Very good. Excellent. Can anyone tell me what is syndesmosis? Syndesmosis is a type of fibrous joint. Fibrous joint. So fibrous joint are of three types: sutures, syndesmosis, yes, third one, gomphosis. So sutures, syndesmosis, and gomphosis, these are examples of fibrous joints, right? And what is the example of syndesmosis? The intraosseous membrane between the radius and ulna, the tibia and fibula. So that's the syndesmosis. Perfect, very good. Okay. What is symphysis? Bachcho, symphysis is a secondary cartilaginous joint. Secondary cartilage joint. The primary cartilage joint is known as synchondrosis. Synchondrosis. The secondary cartilage joint is known as symphysis. Symphysis. Example is pubic symphysis, right? The intervertebral joints. Good. Clear to all of you? The answer for this is synovial joint. I hope I'm clear to all of you, bachcho. Are you able to follow now? I'm trying to make it as easy as possible for you. In case of doubts, please do ask. So going to the next MCQ, students, come on. If you can answer this. Nerve supply of the shown muscle. Yes, can anyone tell me what is this muscle? What is this muscle? A muscle which begins from the cervical vertebrae here. A muscle which comes and gets inserted on the scapula. Which border of the scapula is this? That's the medial border of the scapula. Medial border of the scapula. From the superior angle to the spine. This muscle is attached from the superior angle to the spine. What is this muscle known as? This muscle is the levator scapulae. Levator scapulae. Opposite to the spine, what is this muscle? Rhomboides minor. And below the spine, what is this muscle? That's the rhomboides major. That's the rhomboides major. Perfect. And so what is the nerve supply of levator scapulae? Any guesses? Any guesses? Come on, bacho. What is the nerve supply of levator scapulae? Levator scapulae, rhomboides minor and rhomboides major. All these three muscles are supplied by what? Shall I answer? Even if it is wrong, it's okay. It's okay even if it is wrong. I'm here to correct you. You can make mistakes here, not in the exam. Right? The nerve supply of levator scapulae, the rhomboides minor. So this is levator scapulae. Here will be rhomboides minor and that's rhomboides major. The nerve supply is, yes, dorsal scapular nerve. The answer is dorsal scapular nerve. It is also known as the nerve to rhomboids. Nerve to rhomboids. And this nerve to rhomboids arises from, yes, the dorsal scapular nerve arises from C5 root of the brachial plexus. C5 root, dorsal scapular nerve. Perfect. Okay, what is the suprascapular nerve supply? The suprascapular nerve supplies the supraspinatus and infraspinatus. The two muscles, supraspinatus and infraspinatus, are supplied by whom? The suprascapular nerve. And this suprascapular nerve arises from upper trunk of the brachial plexus. From the upper trunk of the brachial plexus. Two nerves, hai? One is the suprascapular nerve. The second nerve is what? The nerve to subclavius. Excellent, very good. The one is suprascapular and the second one is the nerve to subclavius. Clear now? So, hello students. One is suprascapular nerve and the nerve to subclavius. Okay, what is the subscapular nerve supply? The subscapular nerve supplies the subscapularis muscle. And subscapularis nerve are two. Now, those subscapular nerve होते हैं ना, one is the upper subscapular nerve, the second one is the lower subscapular nerve. And both the upper and lower subscapular nerve arises from where? They arises from their branches of posterior cord of the brachial plexus. They are branches of posterior cord of brachial plexus. Upper and lower subscapular nerve. Correct? Perfect, बच्चों. Dorsal ramus of C1. Dorsal ramus of C1 supplies the muscles of the back. The answer for this is dorsal scapular nerve. What are the muscles attached here? Can anyone tell me what is this muscle and what is this muscle? This is the teres minor and this muscle is going to be the teres major. Teres minor, teres major. Okay. Perfect. So let us go to the next slide. Students, I hope you are able to follow this. The block shown in the diagram is going to affect all the following nerves except. So what is this block known as? Which is the nerve here? You can see this mandible. What is this process, Pacha? What is this process of the mandible? The coronoid process. What is this process of the mandible? The condyloid process. What is this for the mandible? Ye kya hai? That's the mandibular foramen. Mandibular foramen. And what enters into this mandibular foramen is the inferior alveolar nerve. Inferior alveolar nerve. Okay. So what enters into the mandibular foramen is the inferior alveolar nerve. This inferior alveolar nerve supplies the lower jaw, and the teeth. It supplies the lower jaw and the teeth. Emerges out as, any guesses? It emerges out. There's a foramen here, chin and a chin. What is this foramen here? Mental foramen. Emerges out as mental nerve. The nerve is known as mental nerve. And this mental nerve is going to supply the skin over the chin. So inferior alveolar nerve enters the mandibular foramen, supplies the lower jaw, it supplies the lower teeth, it emerges out as mental nerve. Now before it enters the mandibular foramen, it gives a branch. What is that branch? Before it enters the mandibular foramen, it gives a branch that is nerve to mylohyoid. Nerve to mylohyoid. And this nerve to mylohyoid supplies two muscles, which is that the mylohyoid and the anterior belly of digastric. Mylohyoid and the anterior belly of digastric, the nerve to mylohyoid. So before the inferior alveolar nerve enters the mandibular foramen, it gives a branch. That's a nerve to mylohyoid. And this nerve to mylohyoid supplies two muscles, the mylohyoid and the anterior belly of digastric. Students, this is extremely important. Yes, so this block will affect what? It will affect the inferior alveolar nerve. Yes. It will affect the mental nerve. Yes, because inferior alveolar nerve ka continuation is the mental nerve. Nerve to mylohyoid. Yes, the nerve to mylohyoid is a branch of inferior alveolar nerve. So what would not be affected is buccal nerve. Buccal nerve arises from anterior division of mandibular. Buccal nerve is a branch of anterior division of mandibular. Perfect. The answer is buccal nerve for this. Buccal nerve. Perfect hai bachcho, perfect. Hello. Are you able to follow this? Follow, be interactive. Okay, good. Fine. I hope this is clear. Coming to the next MCQ, students, I'm sure you must be knowing this. Come on, answer this. Identify the muscles shown in the image. Yeah, what are these muscles? Chalo, answer, guess. What are these muscles? Any guesses? These muscles arise from the tendons of, what are these tendons? Of flexor digitorum profundus. So these muscles are small worm-like muscle which arises from the tendons of flexor digitorum profundus, and these muscles are known as lumbricals. Answer is lumbricals. Lumbricals or lumbricals. Kitne lumbricals hai? How many lumbricals do we have? Four. Out of this, 2 lateral lumbricals and 2 medial. 2 lateral and 2 medial. Two lateral umbilicals are supplied by which nerve? Medial nerve. Okay, lateral umbilicals are the first and the second, or I can say first and second is supplied by medial nerve. The two medial, that's third and fourth lumbrical, are supplied by what? Ulnar. Third and fourth lumbricals are supplied by ulnar. This is clear to all of you? So first and second is supplied by medial nerve. The third and fourth is supplied by ulnar. The answer is lumbricals. What is the action of lumbricals? Can anyone tell me, students? Chalo, bolo. What is the action of lumbricals? It causes flexion at metacarpophalangeal joints and extension at interphalangeal joints. So flexion at metacarpophalangeal joints and extension at interphalangeal joint. This is the action of lumbricals. The first and second lumbricals are supplied by medial nerve. The third and the fourth are supplied by ulnar nerve. Yes, the palmar and the dorsal interossei. This is supplied by whom? Ulnar nerve. Palmar and dorsal interossei are supplied, all are supplied by ulnar nerve. Flexor digitorum profundus. Can anyone tell me? Flexor digitorum profundus is supplied by two nerves. One is medial nerve and the ulnar nerve. Flexor digitorum profundus has got a dual nerve supply, two nerve supply. One is the medial nerve and the other one is the ulnar nerve. A muscle which receives nerve supply from two different nerves. A muscle which receives nerve supply from two different nerves. We call them as what? Composite muscle. Very good. Composite muscle. So muscle which receives nerve supply from two different nerves is known as a composite muscle. Just remember the list of composite muscles in the body. One composite muscle is flexor digitorum profundus. Perfect. Hope you're going well. Very good. Very good. You're answering so nicely. Come on, come on, come on. Let us go to the next MCQ. Here we go. So maximum number of MCQs, maximum number of topics I'm trying to cover. A child lacks thymus and inferior parathyroid glands. Defective development of which of the following structures is likely to be the cause? So what is this? These are the endodermal pouches. This is the first pouch. That's a second pouch. That's a third pouch. That's a fourth pouch. Endodermal pouches, right? So, bacho, the first endodermal pouch forms what? The first endodermal pouch forms the tubotympanic recess. It forms the middle ear cavity. Look, this is the middle ear cavity. This is the middle ear cavity, and that's the eustachian tube. Eustachian tube. So the first endodermal pouch, the dorsal part is going to form the middle ear cavity and the eustachian tube. The ventral part of the first joins with the second and forms the tonsillar fossa or the palatine tonsil. The third, so second endodermal pouch forms a palatine tonsil. The third endodermal pouch divides into three parts. The third endodermal pouch divides into a dorsal and a ventral part. Dorsal and ventral part. The dorsal is going to form what? The dorsal is going to form the inferior parathyroid, and the ventral is going to form the thymus, right? So the ventral is going to form the thymus and the dorsal is going to form the inferior parathyroid. The fourth endodermal pouch again divides into a dorsal and ventral. The dorsal is going to form the superior parathyroids and the ventral joins with the sixth and forms the ultimobranchial body. Ultimobranchial body. Here, so what is the answer for this? Answer is third endodermal pouch. So third endodermal pouch se kya banta hai? What do you get from the third endodermal pouch? Is the thymus and the inferior parathyroid. Thymus and inferior parathyroid. The fourth endodermal pouch forms the superior parathyroids and the ventral part joins with the sixth to form the ultimobranchial body. Very important MCQs, these are very important. Okay, so answer for this is third. Come on, let us go to the next MCQ. Yes, identify the correct statement regarding the mark structure. Come on students, can you identify this? So what is this mark structure? What is this mark structure? This mark structure is the pterion, right? This mark structure is the pterion. The gun is placed here on the pterion, and this pterion is a meeting place of four bones, right? This pterion is a meeting place of four bones. Which are those four bones? One is the frontal, one is the parietal, one is the temporal bone, and one is the sphenoid bone. Temporal and sphenoid. So frontal, yes, frontal is clear, temporal is clear, or parietal, temporal, and sphenoid bone. So the meeting place, it's an H-shaped suture like this, H-shaped suture here, and this is what we call as the pterion. Pterion. The pterion is formed by 4 bones: the frontal bone, the parietal bone, the temporal bone, and the sphenoid bone. And what is the importance of pterion, bacho? There's an artery which lies deep to the pterion. Any guesses? The artery is middle meningeal artery. Middle meningeal artery. So blow to the lateral side of the skull injuries mark the skull injures the mark structure. Yes, so lateral side the injuries will damage the structure. Accessory meningeal artery lies under the structure. That's wrong. Which is the artery which lies below the pterion? That's a middle meningeal artery. Middle meningeal artery. It's not accessory meningeal, middle meningeal artery. It corresponds to the site of anterolateral fontanelle. So this is the anterior fontanelle, each of the posterior fontanelle, and you've got anterolateral fontanelles. I hope you're able to follow this. Yes. So this is correct, this is correct, this is correct. Incorrect statement is C. Accessory meningeal artery lies under the structure. Perfect. Very good. Let us go to the next MCQ, bacho. What are the derivatives of the mark structure? Yes, any guesses? Can you see this mark structure? This is the mark structure. Huh? That's a mark structure. So what is this tube, bacha? This is the neural tube, right? The tube in the center is the neural tube, and the neural tube is ectodermal in origin. The neural tube is derived from ectoderm like this. And when the neural tube is being formed, there are a group of cells which get separated from the ectoderm. They get separated from the ectoderm, and this group of cells lie on either sides of the neural tube. So this is the neural tube. And what are these cells? These are the neural crest cells. Neural crest cells. Okay. The neural tube, by the side of neural tube, what you get? Neural crest cells. And this neural crest cells will give rise to a variety of structure. It gives rise to many structures. What are those? Odontoblast. Yes, these are the teeth forming cell, the sympathetic chain, the dorsal ganglion and the sympathetic ganglion, the melanocytes, the nephrogenic cord. No. Nephrogenic cord is not there. The bulbous cordis, yes, and the conotruncal septum. Bulbous cordis. The conotruncal septum is here. Bulbous cordis is not there. Bulbous cordis is derived from the primitive ventricle, right? So what is the answer for this? 1 is correct, 2 is correct, 3 is correct, and 6 is correct. 1, 2, 3, 6. 1, 2, 6. Answer is C for this. Answer is C for this, right? Here to all of you students. So the neural crest cells gives to a variety of structure, gives rise to a variety of structure. Which are those? The odontoblast, the melanocytes, the dorsal ganglion, the sympathetic ganglion, the Schwann cell, right? The corneal stroma, the parafollicular C cells of thyroid. So what it does not form is the nephrogenic cord. Nephrogenic cord is derived from the intermediate plate mesoderm. And the bulbous cordis is derived from the ventricular chamber, primitive ventricular chamber, right? So the answer is 1, 2, 3, and 6. Answer is C for this. C. Yeah, now coming to the next MCQ. Students, come on, if you can answer this, come on. Identify the cranial nerve that arises from the mark structure. Yes, this is the cranial nerve, bacho. This is the cranial nerve here. That's a cranial nerve. So what is this? That's a pons. And what is this? That's a medulla. So what is this junction known as the pontomedullary junction? At the pontomedullary junction, there are 3 nerves. There are 3 nerves at the pontomedullary junction. That's a 6th, 7th, and 8th nerve. 6, 7th, and 8th. There are 3 nerves, right? So the medial most nerve attached to the pontomedullary junction is 6th nerve. Answer is 6. Medial most nerve attached to the pontomedullary junction is the 6th nerve. I'll just tell you the rest of the nerves. Look, this is the midbrain here. That's the pons here. That's the medulla here. These are the pyramids here. These are the olives. And this is the inferior cerebellar peduncle. Inferior cerebellar peduncle. That's the middle cerebellar peduncle. Middle cerebellar peduncle. Okay, so this is the midbrain, right? That's a midbrain. This is the pons. This is the medulla. This is the pyramid. That's the olives. And what's this? Inferior cerebellar peduncle. Perfect. Now, which are the nerves attached to the midbrain? This is the third nerve and the fourth nerve. The third and the fourth nerves are attached to the midbrain. All the cranial nerves emerge from the ventral aspect of the brainstem except trochlear nerve, the fourth nerve. So this is the third, and that the fourth nerve arises from the dorsal aspect of the brainstem. The nerve attached at the junction of pons with the middle cerebellar peduncle. That's a fifth nerve, right? So the fifth nerve is attached at the junction of the pons with the middle cerebellar peduncle. At the pontomedullary junction, there are three nerves: the sixth, the seventh, and the eighth nerve. Sixth, seventh, and eighth nerves are attached to the pontomedullary junction. The ninth, the 10th, and the 11th are attached between the pyramids and between the olives and the inferior cerebellar peduncle. Okay, 9, 10, 11 are attached between the olives and the inferior cerebellar peduncle, and the 12th nerve is attached between the pyramids and the olives. Between the pyramids and the olives is the 12th nerve. Perfect, students. Are you able to follow this? Okay, so what is the answer for this MCQ? This is the abducens nerve. Lateral to the abducens is going to be the facial nerve. Glossopharyngeal nerve is between the olives and the inferior cerebellar peduncle, and oculomotor is attached to the midbrain. The answer is C. Come on, bacho, come on. Answer this. Fibers from the arrow marked structure in the following diagram reaches to which nucleus of thalamus? Any guesses? What is marked here? What is this structure which is marked here? Chalo bacho, bolo, come on, be interactive. What is this structure? This structure is the mammillary body. Mammillary body. And where does the mammillary body project to? The mammillary body is going to project to the anterior nucleus of thalamus. It is going to project to the anterior nucleus of the thalamus, and this is what we call as the mammillothalamic tract. Okay, it is known as the mammillothalamic tract. This tract is known as the mammillothalamic tract, right, bacho? And what is this responsible for? Attention and recent emotions and recent memory. This belongs to the limbic system. Okay, you know hippocampus? Hippocampus se fibers begin, that is known as alveus. Alveus se banta hai fimbria. Fimbria ka banta hai fornix. The fornix goes and releases in the mammillary bodies. From the mammillary bodies, they go to the anterior nucleus of thalamus. And from the thalamus, via the cingulate gyrus, they go back to the hippocampus. And this is what we call as the Papez circuit. Papez circuit. And this Papez circuit is responsible for emotions and recent memory. Correct? Emotions and recent memory. So answer is anterior nucleus of thalamus. Okay, I hope you are getting this, students. A very, very important MCQ. Very important. Limbic system. You got this? Attention and recent memory. Pay attention. And when you keep on revising, okay, I'll just write this down for you. Hippocampus. Hippocampus se banta hai alveus. Alveus se banta hai fimbria. Fimbria se banta hai fornix. Fornix relays in the mammillary bodies. From the mammillary body, the fibers go to the nucleus of thalamus. Then via the cingulate gyrus, it goes back to. So this is what we call as. And this Papez circuit is responsible for emotions and recent memory. Hope you're getting this, students. Now. Okay, come on. Easy MCQ. A patient had inability to flex the distal interphalangeal joints. Bacho, distal interphalangeal joints of 4th and 5th digits of the right hand. That means the person cannot flex the distal interphalangeal joints of the ring and the little finger, 4th and the 5th digits. He was also unable. So that means which muscle is this? Which is the muscle which is inserted into the base of the distal phalanx? Which is the muscle which is going to cause flexion at the distal interphalangeal joints? Come on, answer this. This muscle is the flexor digitorum profundus. Flexor digitorum profundus. Okay, so flexor digitorum profundus for the first, for the index finger. Okay, I'll make it like this. So flexor digitorum profundus for the index for the ring and little finger. Okay, so flexor digitorum profundus for the index and middle finger, ring and little finger. So this is supplied by whom? This is supplied by medial nerve, and this is supplied by ulnar nerve. That means last two digits, flexor digitorum profundus is going to flex the distal phalanges. The nerve is ulnar nerve, so ulnar nerve is injured, right? Okay. He's also unable to hold a piece of paper between the fingers. Now, what is this? Holding piece of paper between the fingers. What is this? This is adduction of fingers, and this is known as the paper test. Which muscles are we testing? If we hold papers between the fingers, which muscle are we testing? The palmar interossei. And the palmar and the dorsal interossei are supplied by which nerve, bacho? Ulnar nerve. So, which is the nerve involved here? Ulnar nerve, right? So the nerve would be most likely to be injured at which of the following regions? So where is the ulnar nerve commonly injured? Here. So this is D. It goes behind the medial epicondyle, correct? The nerve goes behind the medial epicondyle. The nerve gets injured behind the medial epicondyle. That's the ulnar nerve. Which is the nerve which winds around the neck of the humerus? That's the axillary nerve. Which is the nerve going like this? Through the spiral groove, that's the radial nerve. Perfect, perfect. Radial nerve. The answer is D for this. D. I hope I'm clear to all of you. Okay, students, we go to this MCQ. Answer this. Which cranial nerve fibers are found at the point marked by the arrow? Okay, look at this. This is the arrow. That's a pointed arrow. So which is this part? Can anyone tell me what is this part? This much part is the midbrain. That's a pons. That's a medulla. Right? Midbrain, pons and medulla. Correct? So midbrain, let me just draw this. This is the midbrain. That's a pons. That's a medulla. And who's this behind here? That's a cerebellum. The midbrain, we have got two structures like this. What is this? This is the superior colliculus, and that's the inferior colliculus. Superior colliculus, inferior colliculus. So which is the nerve, which is the nucleus, or which is the cranial nerve which arises at the level of superior colliculus? That's the third nerve. And which is the cranial nerve which cranial nerve nucleus lies in the midbrain at the level of inferior colliculus? That's the fourth nerve nucleus. So the nucleus of third nerve, oculomotor nerve, is located in the midbrain at the level of superior colliculus. And the nucleus of trochlear nerve is located in the midbrain at the level of inferior colliculus. So what is marked here? Inferior colliculus. So what is the answer here? Fourth nerve. Clear, bachon? See, the nucleus of third and fourth nerve are present in the midbrain. The nerves are attached to the midbrain. Once again, the nucleus of third nerve is present in the midbrain at the level of superior colliculus, and the nucleus of the fourth nerve is located in the midbrain at the level of inferior colliculus. I hope this is clear. So where is the nucleus of fifth nerve located? In the pons. The nucleus of sixth nerve is also located in the pons. Clear? Third and fourth nerve nucleus are located in the midbrain. And what is this cavity in the midbrain? Can anyone tell me? This cavity in the midbrain is known as what? What is this cavity known as? Aqueduct of Sylvius. What is this? That's a fourth ventricle. And what's this? Central canal. Perfect, students. Come on, let us proceed. I hope you're getting this. Yes, I hope everything is clear to all of you. In case of doubts, to get back. So understand this, answer this MCQ. Identify the type of cartilage. Can anyone tell me what is this cartilage? So what are you seeing here? Look, number one. What is this? Number one, this is a perichondrium. Look, number one, did I not tell you this is a perichondrium? What are these chondrocytes? Look, these are the chondrocytes, and the chondrocytes are very large, very large. You can see this large chondrocytes. They're not present in groups. The chondrocytes, if they are present in groups like this, in a group of 3, in a group of 4, this is what we call a cell nest. And cell nest is a characteristic of hyaline cartilage. Bacho, cell nest is a characteristic of hyaline cartilage. Now here the chondrocytes are large in size, and you can see this shining elastic fibers, right? The shining fibers are elastic fibers. So this is an example of elastic cartilage. Okay, so perichondrium is present. Chondrocytes are large. Chondrocytes are large in size, and elastic fibers are present. Elastic fibers are present. Perfect. This is clear to all of you. So example of elastic cartilage. And bacho, where do we get this elastic cartilage? Any guesses? Where do we get this elastic cartilage? In the pinna, in the epiglottis, we get this elastic cartilage. Pinna, epiglottis. Okay, white fibro examples I've told you. Hyaline cartilage examples I've told you. What is articular cartilage? The hyaline cartilage, which covers the articular surfaces of the bones, is known as articular cartilage. The hyaline cartilage, which covers the articular surface of the bone, is known as articular cartilage. Only difference there is perichondrium is absent. Perichondrium is absent in articular cartilage. Rest everything is same as hyaline cartilage. Come on, bacho, come on. Can you answer this MCQ? Come on. Which structure is supplied by the nerve causing this elevation? Yes, you can see an elevation here like this. What is this elevation known as? Anyone? Chalo bacho, kuch to answer karo. Something can you answer? What is this? Where are we? What is this structure? This is the fourth ventricle, right? That's the fourth ventricle. So what have we removed to see this fourth ventricle? We have removed the cerebellum. Cerebellum ko nikal diya. We've removed the cerebellum. So what are we finding here is the floor of the fourth ventricle. Floor of the fourth ventricle. So what is this elevation known as? This elevation is known as the facial colliculus. This elevation is known as the facial colliculus. And how is this facial colliculus formed? Bacho, tell me, how is this facial colliculus formed? If you can answer this. So look, this is the sixth nerve. Huh? That's the nucleus of sixth nerve. And these are the fibers of sixth nerve. The nucleus of sixth nerve, the fibers of sixth nerve. And this is the nucleus of seventh nerve. This is the nucleus of seventh nerve. The fibers of seventh nerve wind around the nucleus of sixth nerve and they come out. The fibers of seventh nerve, they wind around the nucleus of the sixth nerve and they come out. When they come out, when they wind around the nucleus of the sixth nerve, they form an elevation here, and this elevation is what we call as the facial colliculus. Facial colliculus. So how is the facial colliculus formed? Bacho, the facial colliculus is formed by the fibers of facial nerve as they wind around the abducens nucleus. Fibers of facial nerve as they wind around the abducens nucleus. So what are the fibers of facial nerve going to supply in this options? Lateral rectus. Lateral rectus is supplied by which nerve? Sixth nerve. Barabar. Lateral rectus is supplied by sixth nerve. Superior oblique is supplied by fourth nerve. Fourth nerve. Rhizorius. Rhizorius is a muscle of facial expression, and this rhizorius is supplied by seventh nerve. So if the facial nerve is damaged, the seventh nerve would be, if the facial nerve is damaged, the rhizorius muscle would be paralyzed. Okay, rhizorius would be paralyzed. and levator palpebrae superioris is supplied by third nerve. Third nerve. Clear, bachcho? Lateral rectus, I told you, no? Sixth nerve. Superior oblique is supplied by fourth nerve. Levator palpebrae superioris is supplied by third nerve. And the rhizorius and the muscles of facial expressions are supplied by seventh nerve. So, what is the MCQ? Which structure is supplied by the nerve causing this elevation? That elevation is what we call as the facial colliculus. And who's going to form this facial colliculus? The fibers of facial nerve forms this facial colliculus. And what will they supply? Rhizorius. Hello, hello, students. Going good? Are you able to follow? Very good. Excellent. Very nice. Very nice. So let us proceed here. Superior boundary of the arrow mark structure is. Look, what is this structure? What is this structure? Where is the arrow into? Any guesses? Come on, bacho. Come on. You can answer this. This you must be knowing. This is a foramen. What is the name of this foramen? That's the epiploic foramen. That's the epiploic foramen. And what are the boundaries of epiploic foramen? What are the boundaries of epiploic foramen? Anteriorly is the lesser omentum. Anteriorly is the lesser omentum. And what is present in the lesser omentum? Three structures: hepatic artery, portal vein, and the bile duct. Three structures present in the lesser omentum. So anterior boundary of epiploic foramen is formed by what? Lesser omentum. And this lesser omentum is going to contain what? The hepatic artery, the portal vein, and the bile duct. The posterior boundary is formed by IVC. IVC. The posterior, what is this structure? This is the IVC. The superior boundary. The superior boundary is formed by this lobe of the lever. What is this lobe? The superiorly is the caudate. Superiorly is the caudate lobe of lever, and inferior, what is this? That's the first part of duodenum. First. Duodenum. Inferiorly is the first part of duodenum. So this becomes the boundaries of epiploic foramen. Okay, bachcho, clear? Are you able to follow this? So anteriorly is the lesser omentum. And what is present within the lesser omentum? Three structures: hepatic artery, portal vein, bile duct. Posterior is what? IVC. Superiorly is the superiorly is the caudate lobe of lever. Caudate lobe of lever. Inferiorly is the first part of duodenum. The first part of duodenum. So these are the boundaries of epiploic foramen. Right, bachcho? And epiploic foramen, what is the importance? Infection from the greater sac can enter into the lesser sac through epiploic foramen. Okay, am I clear? So just try to understand this. Caudate lobe of lever is the superior boundary. Duodenum is the inferior boundary. Lesser omentum is the anterior boundary, and inferior vena cava is the posterior boundary. Okay, fine. Good going, good going. Good going, bacho, good going. Okay, plenty for you, plenty of MCQs. Come on, come on, come on. Be interactive. Come on, plenty of MCQs I've got for you. Okay. Coming to this. During administration of the second dose of COVID vaccine, the nurse observed asymmetry in the shoulders, and the left shoulder appeared to be flabbier. The left shoulder, what is this? What is the shape of the shoulder known as? Shape को क्या बोलते हो? Contour of the shoulder. And this shape of the shoulder is because of what? Deltoid. And which is the nerve supplying the deltoid? Axillary nerve. So if the axillary nerve is injured, the deltoid is paralyzed. The shoulder becomes flabby. The contour, the shape of the shoulder is lost. Flat shoulder. It becomes a flat shoulder, right? So which of the following structure is involved? So answer this. Answer is axillary nerve. And which muscle is that? Deltoid. Muscle is deltoid. Perfect. What is rotator cuff? Rotator cuff is formed by 4 muscles. Any guesses? Rotator cuff is formed by 4 muscles. One is the subscapularis. Subscapularis. The second one is supraspinatus. Infraspinatus. Teres minor. So subscapularis, supraspinatus, infraspinatus, and teres minor. Together, this 4 muscle forms what is known as the rotator cuff muscle, right? The posterior circumflexural artery is a branch of third part of axillary artery. Posterior circumflexural artery is a branch of the third part of axillary artery. And the lateral cutaneous nerve of arm. Lateral cutaneous nerve arm. So there are 2 lateral cutaneous nerve arm. One is the upper lateral cutaneous nerve arm, and the other one is the lower lateral cutaneous nerve arm. The upper lateral cutaneous nerve of the arm is a branch of axillary, and the lower lateral cutaneous nerve of the arm is a branch of radial nerve. It's a branch of radial nerve. Clear? So lateral cutaneous nerve of the arm is divided into 2, an upper lateral cutaneous nerve of the arm and a lower lateral cutaneous nerve of the arm. The upper lateral cutaneous nerve of the arm is a branch of axillary nerve, and the lower lateral cutaneous nerve of the arm is a branch of radial nerve. So rotator cuff muscles are clear: supraspinatus, infraspinatus, teres minor, and the subscapularis. Posterior circumflex is a branch of third part of axillary artery and axillary nerve. The answer here is axillary nerve. It supplies the deltoid. Come on, Bachcho, come on. Can you answer this MCQ? A surgeon performing hip joint surgery on a 49-year-old female accidentally severs the right inferior gluteal nerve. Right inferior gluteal nerve. The inferior gluteal nerve arises from the posterior division of L5S1S2. The inferior gluteal nerve is responsible for supplying the muscle. Which muscle does the inferior gluteal nerve supply? The inferior gluteal nerve supplies the gluteus, right? Gluteus maximus, that's this muscle. That's this muscle. So inferior gluteal nerve is going to supply the gluteus maximus. The superior gluteal nerve supplies 3 muscles: gluteus medius, gluteus minimus, and the tensor fascia lata. Okay, so the superior gluteal nerve is going to supply the gluteus medius, the gluteus minimus, and the tensor fascia lata. The inferior gluteal nerve supplies the gluteus maximus. And what is the action of gluteus maximus? It is a powerful extensor. It's a very powerful extensor. Second, it turns the thigh outwards. So what is that? Lateral rotation. Lateral rotation. So extension, lateral rotation, and abduction. The answer here is lateral rotation and abduction. It also does extension. Extension. Clear? So the muscle is gluteus maximus. It is inserted on the gluteal tuberosity of the femur. The gluteus maximus is also attached into the iliotibial tract. The gluteus maximus is a very powerful extensor of the hip joint. It also does lateral rotation and abduction. The nerve supply of gluteus maximus is inferior gluteal nerve. Perfect then? The superior gluteal nerve supplies the gluteus medius, minimus, and the tensor fascia lata. Very good. Very good. Any doubts you have here, you can ask me. Then we'll proceed. Any doubts? Joe, any doubts? Should I proceed? Okay, thank you. We'll proceed. Here, have a look at this. Which of the following marked structure does not form a part of the laryngeal cartilage, laryngeal skeleton? So what are the cartilages of larynx? How do we classify the cartilages of the larynx? Do you have a slide here for you? Yes, I have a slide for you. Larynx, the cartilages are paired and unpaired. The unpaired कौन है? Who's unpaired? Thyroid cartilage, cricoid cartilage, epiglottis. Thyroid, cricoid, and epiglottis. Which are the paired ones? Arytenoid, corniculate, cuneiform. So arytenoid, corniculate, and cuneiform, these are the paired cartilages, and unpaired cartilages are the thyroid, cricoid, and epiglottis. Perfect है बच्चों? चलो, so these are the cartilages of larynx. Have a look, identify this. Number A. What is this? Number A. A is the hyoid. A cartilage is the hyoid. So hyoid is not a cartilage of larynx. No, it's not a cartilage of larynx. C is epiglottis. C is epiglottis. D is thyroid. B is thyroid, and D is cricoid. D is cricoid. So epiglottis is a cartilage of larynx. Thyroid is a cartilage of larynx. Cricoid is a cartilage. So who's not a cartilage of larynx? Thyroid. Thyroid is a bone. It's not a cartilage. Okay. The answer would be what? A. Answer for this is A. Okay, bachcho. Can you tell me this? Who's a tensor of the vocal cords? Who's a tensor of the vocal cords? Cricothyroid. The tensor of vocal cords is cricothyroid. And who's an abductor of vocal cords? Abductor of vocal cords is posterior cricoarytenoid. Abductor of vocal cords is posterior cricoarytenoid. Tensor of the vocal cords is cricothyroid. Okay. Perfect. Come on, bacho. Come on. Can you answer this? Come on. Have some energy. Students, have some energy. Come on. And answer this MCQ. Neurotransmitters secreted from the pointed structure. This is the pointed structure. What is this dark colored structure? Any guesses? What is this dark colored structure? This is the substantia nigra. Substantia nigra. Yes. Very good. It is present in the midbrain. And this substantia nigra is going to secrete what? Dopamine. It's going to secrete dopamine, right? So this is a section of the midbrain. What is this marked area in the midbrain? This is the section, a coronal section of the brain. So what is pointed here is the midbrain, the substantia nigra, and this substantia nigra is going to secrete dopamine, and damage to the substantia nigra leads to Parkinsonism. Substantia nigra is belonging to what? Basal ganglia, right? It's a part of basal ganglia. Now, which are the other parts of basal ganglia? One is the caudate nucleus and the putamen. What we call this as the striatum. Number 2, globus pallidus. Number 3 is the substantia nigra, and number 4 is the subthalamic nucleus. Right? So these are the parts of basal ganglia. Caudate nucleus and putamen, known as striatum. Second, globus pallidus. Third is the substantia nigra, and fourth is the subthalamic nucleus. Perfect. Very good. Excellent. Very nice. So answer this, bachcho. The cell marked in the given below would be involved in inhibition of which of the following structure? Can anyone tell me what is this microscopic picture of? What is this slide of? Any guesses? What is this microscopic picture? I'll just give you a hint. This is what we call as molecular layer. This is pyramidal cell layer. And what is this layer? Granular cell layer. So, yes, any guesses? Molecular layer, granular cell layer, and the Purkinje cell layer. Yes, what is this? Excellent. Very good. This is the cerebellum. This is a slide of cerebellum. And what is pointed is the Purkinje cell. And this Purkinje cell is going to inhibit. It inhibits the deep cerebellar nucleus, deep cerebellar and lateral vestibular nucleus. It inhibits the deep cerebellar and the lateral vestibular nucleus. Remember students, cerebellum is mainly sensory. It has got a sensory input. The only motor output from the cerebellum are the Purkinje cells. And this Purkinje cells are going to inhibit the deep cerebellar nuclei and the lateral vestibular nucleus. Now, which are the deep cerebellar nucleus? We have got 4 deep cerebellar nucleus. Nucleus globus, nucleus emboliformis, nucleus dentatus, and nucleus fastigi. These are the 4 cerebellar nucleus, right? Dentate nucleus, nucleus globus, nucleus emboliformis, and nucleus fastigi. Perfect. Very good. Fine. Clear, students? Very good. Very good. Going to the next slide. Here we go. Here we go. Come on, answer. Identify the marked tendon in the diagram. Yes, this is the diagram of the foot. Which aspect of the foot are you looking at? Dorsal aspect of the foot. And this is the muscle which is going to the great toe. Great toe. Can anyone tell me what is this tendon going to the great toe? This is the extensor hallucis longus. Extensor hallucis longus, right? What is this? This tendons are extensor digitorum longus. This is the tendon of peroneus tertius. And there will be one tendon here. This is tibialis anterior. So tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. Right? These are the muscles which belongs to the anterior compartment of the leg. And which is the nerve here? The nerve is deep peroneal. No, deep peroneal. So tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tertius. The nerve is deep peroneal nerve. And if these muscles are paralyzed, the foot goes down. What is this known as? A foot drop. Very good, students. Very good. You are answering very well. The foot goes down. That's a foot drop. Foot drop. Yes, very good. Right. Correct. The answer is extensor hallucis longus. Perfect. Come on, bacho. Can you answer this MCQ? An injury to the shown area can lead to fracture of which of the following bone? Which bone? So what is shown here? What is this triangular structure? Any guesses? What is this triangular area? This is what we call as the anatomical snuff box. Anatomical snuff. So this triangular area is the anatomical snuff box. And bacho, can you tell me what are the boundaries of the snuff box? Any guesses? The lateral boundary of the snuff box. I just mentioned it here for you. The lateral boundary of the anatomical snuff box is formed by abductor pollicis longus and extensor pollicis brevis. Abductor pollicis longus and extensor pollicis brevis. The medial boundary is formed by extensor pollicis longus. The lateral boundary is formed by abductor pollicis longus and extensor pollicis brevis. The medial boundary is formed by extensor pollicis longus. The floor is formed by thyroid process of radius, scaphoid, and trapezium. both. Styloid process of radius, scaphoid and trapezium bone. So which, if this anatomical snuff box is injured, which is the bone fractured commonly? That's the scaphoid. Scaphoid is fractured. Okay, so the lateral boundary of the anatomical snuff box is formed by abductor pollicis longus and the extensor pollicis brevis. The medial boundary is formed by extensor pollicis longus. The floor is formed by the styloid process of radius, the scaphoid and the trapezium. And the content, any guesses? Content? Radial artery. Radial artery is a content. And roof में क्या है? Roof में cephalic vein, superficial branch of radial nerve. Roof contains the cephalic vein and the superficial branch of radial nerve. Cephalic vein and superficial. Students, whatever I'm talking, जो भी मैं बात कर रहा हूँ, everything is important. Everything is important, students, and this MCQs will definitely come in the exam, right? So the answer is scaphoid. Yeah. Okay. Answer this, bachcho. Come on. Identify them. Come on, don't lose your energy, students. Come on. Identify the marked artery originating from the celiac trunk territory. What is this artery? Any guesses? I'll just tell you this. Celiac trunk, in short. What are the three main branches of celiac trunk? One is the left gastric, splenic, and common hepatic artery. Left gastric artery, splenic artery, and the common hepatic artery. The splenic artery gives pancreatic branches, short gastric branches, and the left gastro epiploic artery. The left gastroepiploic artery. The common hepatic artery gives, number one is the right gastric, gastroduodenal, the third one is hepatic artery proper. Hepatic artery proper. So this is conventional what I'm telling you. So the common hepatic artery gives three branches. One is the right gastric artery, the gastroduodenal, and the hepatic artery proper. The gastroduodenal further gives two branches. Any guesses? The gastroduodenal artery further gives the right gastroepiploic artery, and the superior pancreaticoduodenal artery. The right gastroepiploic artery and the superior pancreaticoduodenal artery. These are the branches of gastroduodenal artery. Dear students, the celiac trunk gives three main branches. One is the left gastric, splenic, and common hepatic. Splenic runs on the superior border of the body of the pancreas, gives branches to the pancreas. That's the pancreatic branches. The short gastric branches and the left gastroepiploic artery. The common hepatic gives the right gastric, the gastroduodenal, and the hepatic artery proper. Gastroduodenal further gives the right gastroepiploic and the superior pancreaticoduodenal artery. Right. So answer this. What is this artery? What is this artery which is pointed here? This artery which is pointed here is the right gastroepiploic artery. The right gastroepiploic artery. This right gastroepiploic artery is a branch of common hepatic, which is a branch of celiac trunk. Okay, so that's the gastroepiploic artery. This is clear, bachcho? Fine. Okay. Coming to the next MCQ. Come on, students, can you answer this? Which of the following artery is palpated here? So, what is this artery which is palpated behind the, which is this aspect? This is the great toe. Dekho bachcho, this is the great toe, hai na? This is the great toe. So, which aspect is this? Medial. Hai na? That's a medial aspect of the foot. What is this here? What is this? This is the medial malleolus. Medial malleolus. And which is the artery which goes in the foot behind the medial malleolus? Which is the artery which goes in the foot behind the medial malleolus? That's the posterior tibial artery. Posterior tibial artery goes behind the medial malleolus. It lies in the posterior compartment of the leg. Posterior compartment of the leg. Let me just tell you this. Look, bachcho, popliteal artery gives two main branches. One is anterior tibial and the other one is posterior tibial. Anterior tibial, posterior tibial. Okay, anterior tibial goes to the compartment of the leg. Posterior tibial goes to posterior compartment of the leg. And this posterior tibial artery gives a branch. What is this artery known as? Peroneal artery. It goes to lateral, which goes to the lateral compartment of the leg. So which is the artery in the anterior compartment of the leg, bachcho? Anterior tibial. Which is the artery in the posterior compartment of the leg, students? Posterior tibial. And which is the artery in the lateral compartment of the leg? That's the peroneal artery. And this peroneal artery is a branch of posterior tibial artery. A very, very, very important MCQ for you. Very important MCQ. So which is this artery which is palpated behind the medial malleolus? This is the posterior compartment, right? Posterior compartment of the leg. And which is the artery present in the posterior compartment of the leg? That's a posterior tibial. Posterior. The anterior tibial continues as dorsalis pedis. Anterior tibial continues as dorsalis pedis. Yeah. Hope this is clear to all of you. Yes. Chalo bachcho, can you answer this MCQ? Students, come on. Identify the given structure. Chalo, this you should be able to identify, bachcho, this is very important. Any guess? This. I'll give you a hint. This serous acid. So if I don't see this, agar ye main dekhta nahi hu, I don't see this. If I don't see this structure, I identify this as a serous salivary gland. If I don't see this, I see only this much area, I would identify this as a serous salivary gland. But sure, the moment I look into this, any guesses what is this? Any guesses what is this? These are the islets of Langerhans. Islets of Langerhans. So the moment you get this islets of Langerhans, you are definitely sure that this is pancreas. This is pancreas, right? So pancreas has got two. Pancreas belongs to two. One moment. I'll just mention this. Pancreas has got two parts. One is the exocrine part and the other one is the endocrine part. Exocrine part, endocrine part. So endocrine part represents what? Endocrine part is islets of Langerhans is the endocrine part. Exocrine part resembles to a serous salivary. So I would be getting here plenty of serous acinus. So that resembles a serous salivary gland. So the moment you get a slight serous salivary gland with islets of Langerhans, so that is pancreas. Because islets of Langerhans represents the endocrine part of the pancreas and the serous acinus represents the exocrine part of the pancreas. So that is pancreas. Clear, bachcho? Okay. Coming to the next MCQ, my dear children, come on, answer this. What is the answer for this? Which type of joint is present at the arrow mark in the diagram? Yo. That's the arrow. That's the arrow. Any guesses, bacho? What is this joint? This is a secondary cartilaginous joint. Like, what is this? Pubic symphysis. That is pubic symphysis. So pubic symphysis is a secondary cartilaginous joint. Example is pubic symphysis. Intervertebral joints. Intervertebral joint. Manubrosternal joint. The third example is manubrosternal joint. So this is a secondary cartilage joint. Example of secondary cartilage joints: pubic symphysis, intervertebral joints, and manubrosternal joint. Primary cartilage joints. Primary cartilage joints are known as what? Primary cartilage joints are known as synchondrosis. Primary cartilage joints are known as synchondrosis. And what happens to these primary cartilage joints? They fuse after certain years. After certain years, they fuse. And what is that process known as? Synostosis. So primary cartilage joints are known as synchondrosis. After a certain age, this gets converted into a bone, and that process is known as synostosis. Example of primary cartilage joint. Any guesses? Primary cartilage joint example is? Yes, joint between epiphysis and diaphysis. Joint between epiphysis and diaphysis. The symphysis menti, that's a primary cartilage joint. Fibrous joints are of three types. Can anyone tell me fibrous joints are of three types? Sutures, syndesmosis, comphosis. Sutures, syndesmosis, and comphosis. These are the examples of fibrous joint. These are the types of fibrous joint. Sutures, syndesmosis, and comphosis. So sutures are found in the skull. Example is skull bones. Syndesmosis, example is the intraosseous membrane between the radius and ulnar, tibia, and fibula. Intraosseous membrane between the radius and ulnar, tibia, and fibula. Comphosis is this teeth fitting in the socket, peg and socket type of joint. Teeth fitting in the socket. Perfect, bacho. Yeah, I hope this is clear to all of you. Okay, great. Very good. Answer this, children. Answer this. A person developed following deformity after overhead weight lifting exercises. The person is lifting heavy weights and the person develops this. What is this now? That's the winging of scapula. This is the winging of scapula. Now, winging of scapula, what is the person doing? The person is touching the walls. The person is touching the walls. A person comes to you. That's a winging of scapula. Winging of scapula is caused due to paralysis of two muscles. One is trapezius and second one is the serratus anterior. Trapezius and serratus anterior. Now, how do we differentiate? This is winging due to paralysis of trapezius and this is winging due to paralysis of serratus anterior. How do we differentiate? We tell the person to push the wall or we tell the person to begin a movement. When a person begins a movement and there's a winging of scapula, that's due to paralysis of serratus anterior. And the person is at rest. The person is not performing any action. The person is at rest and still there's a winging trapezius, paralysis of trapezius. Are you following this? I'll just write this down. Winging of rest, on movement, at rest, paralysis of serratus. Perfect है बच्चों. The winging of scapula at rest is due to paralysis of trapezius and winging of scapula on attempting movement is due to paralysis of serratus. Excellent, very good. Very good, very good, very good. Just one moment. Hello. Answer this. Yes. Falling nerves gets compressed in lesions of the uh, arrow marked area. So this is the arrow marked area, which is the nerve which lies here. There's a groove here, students. What's that groove known as? The spiral groove, right? That's a spiral groove. And which is the nerve which is related to the humerus in the spiral groove? That's a radial nerve. That's a radial nerve. The ulnar nerve lies behind the medial epicondyle. Okay, it lies behind the medial epicondyle. The axillary nerve, it winds around the neck of the humerus, right? Axillary nerve winds around the neck of the humerus. Radial nerve lies in the spiral groove. The medial nerve lies on the anterior aspect of the humerus. Anterior aspect. So the nerve is radial nerve. Easy, eh? That was an easy MCQ. Come on, students, answer this. In the given CT scan, the arrow mark structure is. Can anyone answer this? Look, I'll just make a slide here for you. So that's a horizontal section of the brain or a transverse section of the brain. You get a nucleus here, you get a nucleus here, and you get a nucleus. Okay. And you get white matter. So what is this? V-shaped structure, internal capsule. That's the internal capsule. What is this nucleus? That's a caudate nucleus. What is this? That's a thalamus. And what is this? That's the lentiform nucleus. Lentiform nucleus. The lentiform nucleus is made up of outer putamen and inner globus pallidus, right? So inner globus pallidus and outer putamen, that's the lentiform nucleus. One on the medial side is the caudate nucleus and behind is the thalamus. This V-shaped structure is the internal capsule. That's the internal capsule. Okay. The same thing in the slide here. So now can you identify this? What is this structure, students? That's a caudate nucleus. This is the thalamus. And what is this? Lentiform nucleus. And you can see that black structure area in between. That's the internal capsule. Internal capsule. So what is marked here is the lentiform nucleus. Lentiform nucleus. Clear, students? Are you able to follow? Hello, let us go to the next slide. Students, answer this. In case of cervical rib, as presented with tingling sensations and paresthesia on the medial side of the arm. There is tingling and paresthesia on the medial side of the arm. Which of the following structure is most likely to be affected? The medial aspect of the arm, there is paresthesia. Which nerve is that? That's the medial cutaneous nerve of arm. Medial cutaneous nerve of arm. Okay. Paresthesia on the medial aspect of the arm. That's the medial cutaneous nerve of the arm. And this medial cutaneous nerve of the arm is a branch of the medial cord. Medial cord of the brachial plexus. Medial cord of the brachial plexus. Okay. Clear? How is the medial cord formed? How is the medial cord formed? Any guesses? Here, I'll quickly go through this. This is C5, C6, C7, C8, and T1. These are the ventral rami. C5, C6 joins to form the upper trunk. C7 becomes the middle trunk. C8 and T1 joins to form the lower trunk. Okay, upper trunk, middle trunk, lower trunk. Now, each of this trunk divides into a dorsal, and dorsal divisions and a ventral, and ventral division. The ventral division of the upper and middle trunk forms the lateral cord. The ventral division of lower trunk continue as the medial cord, and the dorsal division of all the three trunks joins to form the posterior cord. Posterior cord, right? So C5, C6 joins to form the upper trunk. C7 continues as the middle trunk. C8 and T1 forms the lower trunk. Divides into a dorsal and ventral division. The ventral division of upper and middle trunk forms the lateral cord. The ventral division of lower trunk continues as the medial cord. So medial cord is a continuation of the lower trunk of the brachial plexus, and lower trunk is marked by what? C. So answer is C for this. C. समझ में आ रहा है ये बच्चों? Are you able to follow this? So a case of cervical rib. This is cervical rib. So if there's a cervical rib, which trunk of the brachial plexus gets compressed? The lower trunk of the brachial plexus, lower trunk. And the medial cord is a direct continuation of the lower trunk. समझ में आ रहा है? The medial cord is a direct continuation of the lower trunk. And that is why there is tingling and numbness on the medial aspect of the arm. The answer for this is lower trunk. Come on students, come on, if you answer this. In the given image X, the marked structure terminates at. Chalo bachcho, can you tell me what is this X structure? What is this X-shaped structure? This is the thoracic duct. This is the thoracic duct. And this thoracic duct is formed in the abdomen. Bachcho, this thoracic duct is formed in the abdomen. This thoracic duct from the abdomen comes in the thorax through the aortic opening of the diaphragm, right? Aortic opening of the diaphragm, three structures come. One is the aorta, the azygous vein, and the thoracic duct. So the thoracic duct is in the abdomen. It enters the thorax through the aortic opening. The thoracic duct lies on the, it lies on the right side. It lies on the right side. Then it crosses to the left side at T5 level. It crosses to the left side. Now it climbs on the left side and it opens at the junction of the left internal jugular and the left subclavian veins. The left internal jugular and the left subclavian vein, what opens is the thoracic duct. Here it opens. So the junction of left internal jugular and the left subclavian vein. Are you able to follow this, bachcho? The thoracic duct. Thoracic duct is in the abdomen, enters the thorax through the aortic opening of diaphragm, lies on the right side, ascends up, crosses to the left at T5. T5 it crosses to the left, ascends on the left side and opens at the junction of the left internal jugular and the left subclavian vein. Left internal jugular and the left subclavian vein. That's the thoracic duct for you. Okay, so the answer is D for this. D. Perfect. Students, come on. In the given image, the tendon, yes, what is this marked tendon? Can anyone guess this tendon? What is this tendon showing? What is this tendon? So which are the muscles in the front of the arm? Superficial muscles. Can anyone tell me the superficial muscles in the front of the arm? One is pronator teres. Pronator teres. Second is flexor carpi radialis. So this one is the flexor carpi radialis. It's on the lateral side, right? Flexor carpi radialis. The third one is palmaris longus. Palmaris longus. The fourth is flexor digitorum superficialis. And the last one is flexor carpi ulnaris. Flexor carpi ulnaris. So the superficial muscles in the front of the forearm, the first is pronator teres. The second one is flexor carpi radialis. Flexor carpi radialis. The next one is palmaris longus. The next is flexor digitorum superficialis. And the last one is flexor carpi ulnaris. Out of all this, these four are supplied by which nerve? Median nerve. Median nerve, and flexor carpi ulnaris is supplied by the ulnar. Flexor carpi ulnaris is supplied by ulnar. Perfect. Hello students. Are you able to follow? Very nice, very nice. Good. Thank you. Good. My dear children, can you answer this? Muscle attached to the arrow marked by the bony structure. Yes, what is this? This is the femur, right? This bone is the femur. What is this for the femur? That's the head of the femur. That's the neck of the femur. That's the greater trochanter. And what's this? That's a lesser trochanter of femur. That's the lesser trochanter, right? And what is attached to the lesser trochanter? The iliacus, the psoas major. The iliopsoas. The iliopsoas is attached to the lesser trochanter, right? Where is the gluteus maximus attached to? The gluteus maximus is attached to the gluteal tuberosity, and iliotibial tract. Gluteal tuberosity and the iliotibial tract. Okay. So, which is the muscle attached to the greater trochanter? Look at this greater trochanter. Greater trochanter. Lateral aspect, anterior aspect. Lateral aspect is gluteus medius, and anterior aspect is gluteus minimus. Gluteus medius, gluteus minimus. So, greater trochanter. On the lateral side of the greater trochanter is gluteus medius. On the anterior aspect of greater trochanter is gluteus minimus. And tip of the greater trochanter, what is attached to the tip of the greater trochanter? Pyriform. So the tip of the greater trochanter is pyriform. Which is the muscle attached to the lesser trochanter? The iliopsoas, the iliacus and the psoas major. The sartorius begins from the anterior superior iliac spine, and the sartorius is inserted on the tibia. Honeymoon muscle, sartorius. Gracialis is anti-rapist muscle. Okay, bachcho, answer this. Easy MCQs. Answer this fast. In the given X-ray, the marked arrow tarsal bone is. What is this boat-shaped bone? Any guesses? I know. I definitely know you must be knowing this. What is this boat-shaped bone? That's the cuboid. No, that's a navicular. The boat-shaped bone is a navicular bone. Navicular, right? This is the calcaneum. Calcaneum. That's the talus. Calcaneum talus. That's a navicular bone. This is the cuboid. Okay, that's a cuboid. These are the three cuneiform, and these are the metatarsal bone. Metatarsal. Right? So below is the calcaneum, above is the talus. This boat-shaped bone is navicular bone. This is a cuboid. There are three cuneiform bones, the metatarsal bones. So what is the answer for this? Navicular. Navicular. Very good, very good. You answered correct. Answer this. The arrow marked muscle is. Come on. This you should know. This you should know. Which is this muscle which is marked here? This muscle is the genioglossus. And genioglossus is known as the safety muscle. Safety muscle of the tongue. Safety muscle of the tongue. Why is it known as the safety muscle? Because it protrudes the tongue. It protrudes the tongue. So if it prevents the falling back of the tongue. The tongue does not fall back. If the patient is unconscious, genioglossus is not working, the tongue goes back, the person dies. So genioglossus is known as the safety muscle of the tongue because it is going to protrude the tongue. Right? And this genioglossus is supplied by which nerve? The hypoglossal nerve. The genioglossus is supplied by the hypoglossal nerve. All the muscles of the tongue are supplied by the hypoglossal nerve except palatoglossus, which is supplied by vagoaccessory complex. So all the muscles of the tongue are supplied by hypoglossal nerve except palatoglossus, which is supplied by the vagoaccessory complex. Remember that. Okay, so this is genioglossus. Perfect. Very nice, sir. Students. You're answering really good. Very good. Very good. Choose the correct matching for the arterial branches in the diagram. Chalo bachcho, I'll just tell you this. Look, you tell me. One moment. That's a first rib. And what is this artery here which crosses the first rib? And what is this muscle here? That's a teres major. And what is this muscle here? This is the pectoralis minor. That's the pectoralis minor. What is this artery? Subclavian artery. Subclavian artery, after it crosses the first rib, right? After the subclavian artery crosses the first rib, it becomes axillary artery. At the lower border of teres major, what is this artery known as? Brachial artery. The axillary artery is a continuation of the subclavian artery at the outer border of the first rib. The axillary artery continues as the brachial artery below the teres major. This axillary artery is divided into three parts by pectoralis minor. That's the first part, that's the second part, that's the third part. Right? So what are the branches from the first part? First part gives one branch. What is this branch? Superior thoracic. Superior thoracic. First part is superior thoracic. Second part gives two branches. One is lateral thoracic and thoracoacromial. Lateral thoracic and thoracoacromial. Third part gives three branches. One is the anterior circumflex humeral, posterior circumflex humeral, subscapular. So anterior circumflex humeral, posterior circumflex humeral, and the subscapular artery. So these are the branches of axillary artery. This should be very clear. Huh? First part, second part, third part. Okay, let us see the MCQ. Choose the correct matching. Huh? Okay. Okay, so this is the first part of the axillary artery. That's the second part, and that's the third part. Okay, this is the third part. That's the second part. That's the first part of the axillary artery. So what is the answer for this? One is superior thoracic, two is lateral thoracic, and three is subscapular. Superior thoracic, lateral thoracic, and subscapular. This is the answer. So this is superior thoracic artery. This is lateral thoracic artery. This is the subscapular artery. Yes, students. So these are the branches of axillary artery. Fine. Good. Chalo, bachcho. Identify this. Identify the type of papillae shown in the microscopic structure. Any guesses? Any guesses? I'm sure you must be knowing this. What is this papillae? This is the circumvallate papillae, the largest papillae with a trench here. And this circumvallate papillae is going to contain taste buds, right? The taste buds. Anyway, we've got four papillae: the filiform, the fungiform, the foliate, and the largest is the circumvallate papillae. The circumvallate papillae has got taste buds. Taste bud. Yeah. So this is answer for this is circumvallate. Correct? You can see the taste buds here. Okay, bachcho, answer this. A patient presented with a history of chop injury to the right hand and is undergoing surgical repairs. It is observed that the patient is unable to completely fold the ring finger while making the fist. The person cannot hold the ring finger. Which structure injury results in this inability? So what are the two tendons which goes to the ring finger? The tendon which goes till the distal phalanx. Yes, the tendon which goes to the distal phalanx. What is this tendon? This is the tendon of flexor digitorum profundus. And the tendon which is inserted on the middle phalanx. What is that? Flexor digitorum superficial. So there are two tendons which are going to the ring finger. To the distal phalanx, what goes is the flexor digitorum profundus, and to the middle phalanx is flexor digitorum superficial. If this tendons are damaged, the person is not able to flex the ring finger. So what is the answer given here? Flexor digitorum superficialis is not in the option, so the answer is going to be the flexor digitorum profundus. Flexor digitorum profundus. I've told you this. Yeah. Flexor pollicis longus goes back to the thumb. Flexor pollicis longus goes to the thumb. Okay. So answer this. Identify the correct pair for the fascia shown in the diagram. Can anyone identify this? Fascias? I'll draw this for you. Just one moment. Have a look at this. So this is the vertebrae. This is a muscle here, that's a psoas major. This is the second muscle here, that's a quadratus lumborum. So this quadratus lumborum is covered by two fascia, number 1 and number 2. And there's a muscle behind here. This muscle, the erector spinae, and this erector spinae is covered by the third fascia. This muscle is the erector spinae, it is covered by third fascia. This psoas major is covered by fourth fascia. Here is psoas major. Psoas major. This is known as a quadratus lumborum. And then you get two muscles here. This is the transverse abdominis, and that is the internal oblique. And the fascia which covers the transverse abdominis is, make this as number 5, fascia transversalis. That's a fascia transversalis. Okay, I'll just mention this for you. Look, I'll just mention this for you. Number 1, the anterior layer of thoracolumbar fascia. Number 2 is the middle layer of thoracolumbar fascia. Number 3, the posterior layer of thoracolumbar fascia. Number 4, psoas fascia. Number 5, the fascia transversalis. Number 5 is the fascia transversalis. What is QL? Is quadratus lumborum. The quadratus lumborum muscle. QL is quadratus lumborum muscle. TA is transverse abdominis. And then you've got the internal oblique. Okay. So the one which covers the quadratus lumborum from front is the anterior layer, from behind is the middle layer of thoracolumbar fascia. The one which covers the erector spinae is the posterior layer of thoracolumbar fascia. The psoas major ko cover karega, that's the psoas fascia, and then you have the fascia transversalis, which covers the transverse abdominis, right? This is the lumbar vertebrae. That's a lumbar vertebrae. Okay, bacho, clear to all of you? So have a look at this. So what is number? Identify the correct pair. What is 1? 1 is fascia transversalis. Okay, so this is to identify correctly, no? 2 is middle layer of thoracolumbar fascia. No, 2 is anterior layer. So this is 2 is anterior layer of thoracolumbar fascia. 3 is middle layer of thoracolumbar fascia. 4 is posterior layer of thoracolumbar fascia. So answer is D for this. This is the fascia transversalis. Fascia transversalis. Yeah, so 2 is anterior layer of thoracolumbar fascia, 3 is middle layer of thoracolumbar fascia, 4 is posterior layer of thoracolumbar fascia, and 1 is the fascia transversalis. I hope I'm clear to all of you. So these are the fascia which covers the abdominal muscles, posterior abdominal wall muscle. To answer this, the following section along the frontal plane is known as, the section is taken like this. So what is this section which divides the body into two halves? This is what we call as a sagittal section. The answer for this is sagittal section. Anything which is at right angles to the sagittal section. If I take a section like this, what is this section? Coronal section. The sagittal section divides the body into two symmetrical halves. A plane which is at right angles to the sagittal section is coronal section. And transverse section would be like this. This is going to be the transverse section. Clear to all of you? Answer is sagittal for this. Okay, just one moment. We're coming to an end. So plenty of MCQs I've put for you this time. Answer this. Which of the following defect is responsible for condition of the mark structure? Bacho, can you tell me what are you seeing here? What are you seeing? The brain is open. The brain is seen here. The skull is open. Brain is seen here. That means this is what we call as anencephaly. And this is due to non-closure of the anterior neuropore. If the anterior neuropore does not close, it results in anencephaly. So that is anterior. If the anterior neuropore does not close, that's anencephaly. If the posterior neuropore does not close, it results in spina bifida. Here to all of you. So anterior neuropore does not close, anencephaly. Posterior neuropore does not close, it results in spina bifida. Okay, I hope I'm getting this. Are you all understanding this? The answer is anterior neuropore. So answer this. What is the diagnosis? But this you should be able to understand. So tell me, loss of sensations on the same side. Loss of tactile discrimination. So there's a paralysis on the right side. There's fine sensations gone on the right side, and there is crude sensations gone on the left side. Chalo, answer this. So crude sensations are gone on the opposite side. Fine sensations are gone on the same side. There's a paralysis of the body on the same side. So this is what we call as the hemisection of the spinal cord. Or this is what we call as the Brown-Séquard syndrome. Brown-Séquard syndrome, right? So the corticospinal tracts cross above. So there will be a lower motor neuron type of, there will be an upper motor neuron type of paralysis on one side, same side. The fibers carrying fine sensations cross above. So there will be loss of fine sensations on the same side. Whereas the fibers carrying crude sensations, they cross at the spinal level. So there will be a loss of crude sensations on the opposite side. And this is what we call as Brown-Séquard syndrome. So Wallenberg syndrome is lateral medullary syndrome. Lateral medullary syndrome is Wallenberg syndrome, thrombosis of pica, posterior inferior cerebellar artery thrombosis leads to lateral medullary syndrome or Wallenberg syndrome. Millard-Gubler syndrome is thrombosis of paramedian branches of basilar. Thrombosis of paramedian branches of basilar artery leads to Millard-Gubler syndrome, that's in the pons. And Weber syndrome is in the midbrain. Thrombosis of posterior cerebral artery. So posterior cerebral artery results in Weber syndrome. Thrombosis of posterior cerebral artery results in Weber syndrome. Thrombosis of pica, the posterior inferior cerebellar artery, results in a syndrome in the medulla known as the lateral medullary syndrome or the Wallenberg syndrome. And thrombosis of the paramedian branches of basilar artery leads to a syndrome that's seen in the pons, that is Millard-Gubler syndrome. Perfect, bachcho? Hello, we'll proceed to the next one. Identify the structure. Come on, bachcho, can you identify this mark structure? This is the tongue, right? Ye tongue hai. So who's this behind the tongue? When you do this thing comes up. Answer is epiglottis. And what's the nerve supply of epiglottis? The internal laryngeal nerve. That's the nerve supply of epiglottis. Yeah, so this is epiglottis, behind the tongue. And the nerve supply of epiglottis is internal laryngeal nerve. Perfect. Come on, students. A patient with leprosy presented with the following finding. Yes, so this is the claw hand. Can you identify this? This is the claw hand of the last two digits. The claw hand of the last two digits, which are the muscles whose paralysis results in claw hand. Lumbricals. Lumbricals, normally they do flexion at metacarpophalangeal joints and they do extension at interphalangeal joints, right? Flexion at metacarpophalangeal joints, extension at interphalangeal joints. When the lumbricals are paralyzed, it results in a claw hand. The first two lumbricals are supplied by medial nerve, the third and the fourth are supplied by ulnar nerve. So this is paralysis of third and fourth lumbricals, the claw hand of the last two digits, injury to the ulnar nerve. Injury to the ulnar nerve. So this is known as partial claw hand. The last two digits, you get a claw hand. That's paralysis of the last two lumbricals. Ulnar nerve is damaged. The first, the middle and the index finger lumbricals are supplied by medial nerve. So you get a claw hand of these two digits. This is partial claw hand. And if both medial and ulnar nerve are damaged, you get a complete claw hand. That's a complete claw. Okay, identify this mark structure. Bacho, can you identify this? So this is the hip bone. That's a hip bone. So what is this going to be? Anterior superior iliac spine. What is this going to be? Anterior inferior iliac spine. Correct? This is the anterior superior iliac spine. That's the anterior inferior iliac spine. What is attached to the anterior superior iliac spine? Yes, two things. One is sartorius. The other one is the ligament. Sartorius and inguinal ligament. Anterior inferior iliac spine. Again, two structures. One is the rectus femoris. Rectus femoris. The second one is iliofemoral ligament. Iliofemoral ligament, that's the ligament of Bigelow. That's the strongest ligament of the hip joint. This is pubic symphysis, right? Distal tuberosity would be backside. Anterior superior spine, two structures attached. One muscle, one ligament. Muscle is sartorius, ligament is inguinal ligament. Anterior inferior iliac spine, again one muscle, one ligament. Ligament is inguinal ligament. Muscle is rectus femoris, the straight head of rectus femoris. I hope you are understanding, bacho. Very good, excellent, very good, very good. The highlighted muscle is supplied by which nerve? Can anyone tell me what is this highlighted muscle? Beautiful. That's the biceps brachii. Right? That's a biceps brachii. And biceps brachii is supplied by which nerve? The musculocutaneous nerve. Let's say the musculocutaneous nerve supplies three muscles. Biceps, coracobrachialis, and brachialis. Medial half of brachialis. The musculocutaneous nerve supplies the biceps, the coracobrachialis, and the medial half of brachialis. The lateral half of brachialis is supplied by radial nerve. Perfect. Clear, students? So that's the biceps brachii. You can see this is the long head of biceps. That's a short head of biceps, which arises from the coracoid process. And the long head of biceps is intracapsular, arises from the supraglenoid tubercle. Perfect. Huh? Very nice. Huh? Very nice. Very good. Very good. Very good. Hello, bacho. Can you identify this? You can see the slide. Beautiful vesicles like this, which are filled with colloid. And they have got an epithelium. What is this epithelium? It's a simple cuboidal epithelium. Colloid filled vesicles. This is the thyroid gland. And what is this in between? These are the parafollicular C cells of thyroid, and this parafollicular C cells of thyroid are going to secrete calcitonin. Right? The colloid filled vesicles secrete T3, T4, TSH, and the parafollicular C cells of thyroid, they secrete calcitonin. So these are the parafollicular C cells, calcitonin. Perfect, bacho, perfect. Come on, identify this. This is a very, very easy MCQ for you. Identify the marked bony process. Yes, what is this? What is this? This is the elbow joint. You can identify this as the humerus. This is the ulna, that's the radius. This is the medial epicondyle, that's the lateral epicondyle, that's the olecranon process of the ulna. This is the head of the radius, that's the neck of the radius, and that's the radial tuberosity. So what is the pointed structure? But show that's the head of the radius. The head of the radius is pointed for us. Just try to be very clear about this, huh? The head of radius. Sometimes the radial tuberosity is also pointed. Perfect. Right, students? Is this clear? So this lecture, this PDF will be uploaded on PW Med Ed Telegram channel. Students, I hope this lecture was clear to you, very informative lecture, and I'm sure you must be knowing most of the things. I'm sure this must be a quick revision for you. This is an attempt made by the PW Med Ed team specially for you, Bacho, and all the best to all of you. Come with flying colors. Right? Thank you to all of you. Thank you from the entire team of PW Med Ed. Thank you and all the best. I'll stop here. Thank you.